We are back on MorningLine, moving right along here as we continue to talk about various aspects of the pandemic, much as we see the state trying to get back to business, and Metro Nashville, of course, starting phase 1 today. A big part of this rebound that we talk about and getting back is going to be isolating, hot spots, contact tracing to continue to follow where the infection goes and try to limit it from spreading. That's so important as we all also try to take precautions, social distancing still, wearing masks, things like that as we slowly move forward. And how that's done and whether enough of it's being done is a topic of conversation. We're going to be talking about it next with our guest, Representative Mike Stewart, here in the state of Tennessee. Representative, can you hear me?
I can.
There you are. Good morning to you. It's nice to have you with us. And listen, now let's get your thoughts right now. I mean, I assume you would agree as we move forward now and things slowly but surely opening up as they are here and across the country, contact tracing is very important. Maybe lay that out for the folks why you think that's critical to the process moving forward.
Here's why it's so important. Health experts know that in order to open up the economy, I hope I didn't lose you there.
There we go.
To open up the economy, we've got to be able to trace each and every person who gets COVID-19, so that they then don't go into a nursing home, they don't go into a plant and infect all these other people. And we've seen in Nashville, we've seen in Sumner County, where nursing homes and plants can be subject of great numbers of infections just because one person went in there who was infected. What contact tracers do is they track the people who've been infected, contact everybody who's been in contact with them, and make sure all of those people separate themselves and quarantine until we know that they don't have the disease. And it takes many, many people to do this contact tracing. All the countries that have gotten this thing under control, like Korea, like Iceland, have done it through extensive contact tracing, and we need to follow their example.
So as we stand now, we know some of this, say in Metro, we hear about this going on. I agree with you. That is a gargantuan task to track everyone down, and having enough people to do it. And it's kind of like detective work. You're tracking folks.
Right.
So what is your take right now? Do we have enough folks at the statewide level doing this? What do you see as a representative? What's needed to do this right?
No, we are completely not set up to do this correctly. I'm very disappointed. I've contacted the Commissioner of Health many times. She sent me a response recently and said that they had approximately 350 people in state government involved, but some of these are volunteers. It's no indication that they're working full-time. According to health experts, we need to have 30 contact tracers per 100,000 population. That would be over 2,000 people engaged in this activity. So we are woefully short. It doesn't make any sense to me because I talk every day to healthcare workers that have been laid off. We've got all sorts of hospitals furloughing people because of COVID-19 and the loss of revenues. So we have all these healthcare workers that could do this contact tracing. They're unemployed. They could do the work. They're highly skilled. Let's put them to work. I don't understand why we're having such difficulty moving this process along.
All right, so if the contact tracing is not done to the point where we can, make sure we alert people and isolate those who need to be in quarantine, what happens then as we move forward? What is the scenario you see in the absence of enough of this being done?
Here's the problem. What will happen is somebody will be infected with COVID-19. If we had a good system, they would immediately be tracked, and we'd talk to all their contacts, and they would be put into quarantine, and that would be the end of the line for the disease. Instead, what they're going to do is they will not be contacted about their contacts. So somebody that they've contacted will now go off to church and perhaps go to a choir practice, as has happened in another state, and infect 30 or 40 people who might then visit their grandparents at a nursing home and infect people in the nursing home. And suddenly you'll have these explosions of COVID-19 that were completely preventable.
A few people on Facebook asking, what qualifications do you really need to do contact tracing? I mean, can people be trained in this fairly quickly to ask the basic questions and alert those?
I'm not a public health expert, but yes, I understand that that contact tracing, while it requires a skilled and dedicated person, it doesn't require a special degree. Epidemiologists have to run the program, but we have epidemiologists at the state. The people who actually do the tracing just need to be qualified professionals. It helps if they have a healthcare background, because then they understand the disease path. But they really just have to be skilled people who can talk to people and do this kind of detective work. So, for example, people who have been furloughed, who are nurses, would be excellent contact tracers. People who have been furloughed, who are physician assistants, would be excellent contact tracers, and many other people who work in the medical profession.
Let's take a phone call from Ann for you on contact tracing. Ann, go ahead. Do you have a question for the representative?
Yes, I do. Last week, within 72 hours, I watched one listing agent take 9 different individuals through a property, none of which were wearing masks, none of which, in between this house being shown, was the house cleaned. And to be honest, the listing agent said she didn't give a rat's A about the mayor's ordinance and proceeded to show these properties without masks for 3 solid days straight. Yes, it was reported, but if any of those individuals were positive, to do contact tracing would be near impossible, because they came by carload and the listing agent would not have had the names of every individual that walked through those properties.
Is that maybe some of the hurdles that contact tracers face? It's not a perfect system, is it?
You know, I think it's a very good question, and it shows why you need to have so many people engaged. I think what would happen in that case, and you're right, some people might get through the net, but the good contact tracing system would talk to the person who got the disease, find out they went to the home to see it at a listing. Then the agent would be contacted, and you'd get a list of every single person who signed up to visit the home. Then those people would be contacted to figure out, well, who were they with and who have they contacted? So literally in that case, because of this irresponsible action on the part of the agent, these contact tracers might have to talk to 100 to 200 people. But look, if that process, as difficult as it is, means that a church is not infected so that senior citizens in the church die of COVID-19, it's well worth it. You know, in the legislature, we devoted millions of dollars to fighting COVID-19. We gave that to Governor Lee with very few strings attached so that he'd have the flexibility to respond. All the public health experts say we need an extensive contact tracing system, and we need to get this system up to speed right now. But that's a great example of the problems we face.
Yeah, we have some people on Facebook, Dennis and others, asking, I mean, how does the concept of contact tracing, which I understand as you've explained it, square with the idea perhaps of the so-called herd immunity, if it can start spreading, and then you have, obviously the enough people that then become immune to it. Do you see a connection there, or that, you could have that as opposed to, worrying so much about contact tracing?
I don't think so. I think it's a good point. I mean, at some point, obviously, we'll either get a vaccine or there'll be a large number of people who are immune to COVID-19. And that'll start to slowly push back, the immunity will start to push back the effect of the disease. But what we want to do is keep as few people as possible exposed and infected. So that, because right now, as we know, we don't have very good systems for dealing with the disease once somebody gets it, and we don't have effective an effective vaccine. So while we're still so vulnerable, we need to do everything we can to prevent the spread of the disease, because we don't have the immunity that is yet protecting us. And we can't just wait for everybody to get immune, because that would mean exposing millions of people in Tennessee, and it would mean extensive amounts of injury and death.
Gotcha.
In addition to our economy being shut down for months and months and months, which most people cannot handle economically.
Well, moving forward, we will see, because we're going to find out as things begin to open up, and most recently, of course, today here in Metro Nashville. Representative, thank you so much for coming on this morning and talking about that, something that we'll watch moving forward. I appreciate your time, sir.
Well, and I appreciate you having me on. Thank you so much.
Thank you so much. That's Representative Mike Stewart joining us. We're going to take a break. When we come back, Vanderbilt University political science professor Thomas Schwartz will be on with us. So we're going to talk a little bit with him about the politics of COVID-19 and how politicians and leaders must balance various aspects of the economy with health and everything else. And we see that happening every day from the White House on down, and how to do that and hopefully how to do it right. We'll take a break and be back with more of your comments as well on Facebook and on the Plus right after this.